Hello, my name is Veronica Lee. I am a graduate of the Master of Philosophy program in Public Policy at the Hong Kong University of Science and Technology, and today I will be presenting submission number 68, Data Governance for the Public Acceptability of Personalized COVID-19 Advice, an Experimental Study in Hong Kong. As we all know, COVID-19 has been a persisting global crisis since the beginning of last year, culminating in over 200 million cases and 4 million deaths as of August 20th, 2021. Also, infectious variants have emerged, causing this issue to be extended. So we may need to deal with this issue for the foreseeable future. Because of this, we need to continually help citizens so that they can make informed decisions as the pandemic evolves. Since governments have been aware of this, they have been able to create many helpful data tools in order to generate general knowledge on COVID-19 for their citizens. And some of these data tools include COVID-19 dashboards, as well as thematic websites centered around COVID-19. However, few of these data tools are tailored to individual needs, making it difficult for citizens to gauge their personal risk of contracting COVID-19. At the same time, higher smartphone use and mobile internet use, as well as the increased generation of mobile data, provide opportunities for these data-oriented solutions, such as applications for personalized advice. And from previous literature in the public health sphere, we know that there are approaches called precision public health, as well as personalized medicine, that use patient data, such as their patient history, as well as genomic data, in order to generate targeted health advice to individuals' needs. And this has been possible due to many technological advancements. However, at the same time, these data tools require an increased collection of personal data, which may deter members of the public from using these types of data tools. And so in order to ensure that the data solutions that we come up with are publicly acceptable, we must balance the public health outcomes of these data tools with data governance issues relating to data privacy, data transparency, public trust, and more. And in the specific context of COVID-19, there have already been several studies looking at how these types of applications or data tools can be realized. For example, Prada and Fenton looked at the Bayesian model that can be used to assess personal risk of contracting COVID-19. Freeman et al. Created a study that looked at the design elements that could improve the communication of risk to individual users. And also the application Hunala by the Human Nature Lab at Yale University was able to use personal data, including users' social networks, in order to predict individual risk of contracting respiratory illnesses, including COVID-19, as you can see in the image on the right. However, as you could probably notice from this list of research, there is a lack of research focusing on how these functions could be balanced with issues of data privacy, as well as other possible societal concerns. And with this in mind, we decided to try to answer the research question: what are the socio-political and data-related factors that would make an app for personalized COVID-19 advice feasible and effective? And specifically, we decided to look at the context of Hong Kong due to the high levels of smartphone penetration and the high amount of sharing of mobile data. And through this research topic, we aim to achieve several objectives, including to identify generalizable policy strategies to increase public acceptability of personalized health advice applications across the globe, to discover how to effectively synthesize various types of data in order to generate public knowledge, as well as to empower citizens to become active agents of knowledge creation during crises so that they can protect themselves as necessary. And the methodology of our study involves using a survey experiment to gauge the willingness of Hong Kong citizens to use a personalized advice application that we had created a mock design for. So the target population of our study is adults residing in Hong Kong, and we are able to recruit a sample of 820 Hong Kong adults via the random sampling approach of the Qualtrics panel service, and we were able to collect data throughout the period of May 21st to June 3rd of 2021. And the survey flow is as follows. Firstly, on the landing page of our survey, we obtained the informed consent of our users, and then we screened the participants by enlisting a list of selection criteria, including that the participants are old enough to provide informed consent and that they are not visually impaired so that they can view the images of the applications that we would be showing them throughout the survey. Then we showed the participants one of 12 variations of the application's mockup design based on differences in the combinations of independent variables, which we'll be sharing on the next slide. Following that, we asked participants to rate their willingness to use the application from on a scale of 1 to 5, with 1 representing that they would be completely willing to use the application and 5 representing they would be completely unwilling. Then we provided a large text box for participants to share more detailed feedback regarding the application and the factors that would either deter or encourage them to use the application. And then finally, there was the debriefing page where we provided our participants with anonymous IDs in case they would like to withdraw from the study. And we allowed them to do so anonymously through this approach. Here are some sample images of the application design that we allowed the participants to see. And the main image that we asked the participants to focus on was the privacy policy, which you can see on the far left. This privacy policy would clarify what types of data would be collected, what the data is used for, and how it would be handled and stored, as well as whether the contact information would be collected, and the developer of the application is listed on the bottom of the application. Then we also had mock-up screens of the user profile and the generated personal level of risk, as well as the tailored recommendations to each individual user. And that includes, for example, location-based risk, where they could input a location and they could understand the risk of contracting COVID-19 based on that location. And in order to analyze the data, we used an ordered logistic regression model in order to assess the correlation between our independent variables, which are the extent of collected personal data or contact information, the method of data storage, whether it's centralized or decentralized, or the developer of the application, whether it is a government department, a public research institution, or a private company. And the control variables that we looked at were age, gender, and level of education. And all of these variables were assessed relative to the dependent variable, which is the willingness of the participants to use the application. And in order to process the data, we used Stata as well as Microsoft Excel, the latter of which is used to qualitatively assess the comments that were made by the participants. And here are the results. Regarding the demographic characteristics of our sample, they closely matched the demographic profile of the Hong Kong population, with the exception of the underrepresentation of citizens aged 55 plus due to the study being conducted exclusively in English. And this could have made the study more inaccessible to some of the members of the older population in Hong Kong who may not be fluent enough in English in order to fully understand the study and therefore share their relevant insights. And after collecting these 820 data points based on our ordered logistic regression analysis, we had identified that gender was the only statistically significant variable with an odds ratio of 1.3. And this suggests that men are generally more willing than women in order to use the proposed application. And we noticed that this was indeed the case across the three independent variables. And as to why this is the case, we would like to share that in the later slides. And in addition to the independent variables that we had identified, the participants also listed other factors, including, for example, the visual elements of the application, such as whether the color scheme is acceptable, whether there are sufficient images for them to understand this, the information being presented, and so on. And the participants also commented on issues of data and data privacy, such as how the data would be securely stored, and also who gets access to the data they're inputting into the application. And then some participants also commented on wanting the application to be simple and user-friendly. Other participants wanted to have more information from the application, such as information regarding testing centers and vaccination centers, or more general information regarding self-protection against COVID-19. And a handful of participants wanted a traditional Chinese option for the application so that they could use it more easily. A few participants emphasized the importance of clarity, and also 5 participants commented on the government, whether it is their general distrust of the government or their concerns about the government being able to access the data they have shared with the application. So the implications of our study are as follows. Firstly, there may be some gender differences in the perception of data privacy risks associated with the use of this application and the sharing of personal data. For example, out of all of the comments that we had received, only 2 comments from specifically female participants had noted that the sharing of location data would not be ideal. And one hypothesis as to why this may be the case is that leaked location data may pose higher safety risks to women than to men. However, we would like to also understand this discrepancy in willingness across genders in more detail, and so that we could be able to adapt data policies accordingly in order to address the underlying gender inequality issues relevant to the application. We also noted that there were greater concerns over other types of personal data in addition to contact information that were being collected. For example, specifically location data, as we mentioned before, but also, for example, health data. This could potentially be some data that people are much less willing to hand over that we had not previously considered. So that would be worthy to investigate. And also there were concerns over data security and who would be able to access the application's data. For example, if the government or other citizens could access that data, and that could be equally or perhaps even more significant compared to whether contact information is being collected or how the data is being stored. So in conclusion, in response to our question regarding the social and political and data-related factors that would affect public acceptability of application for personalized COVID-19 advice, we noted that in Hong Kong, gender played one of the most significant roles in determining whether users would be willing to use the application. Specifically, women in Hong Kong were less willing to use the application than men, possibly due to greater privacy and safety concerns. And also regarding the priorities related to data, the collection of other sensitive data on top of contact information, the security of the data, as well as whether the data can be accessed by unwanted parties would be some of the key issues that should be addressed when creating applications like this, where personalized COVID-19 advice depends on the prolific collection of personal data. Finally, we would like to encourage researchers to conduct more independent studies that are similar to ours, as well as some comparative studies in order to understand the context-specific factors that can affect the public acceptability of these data tools so that they could be feasibly implemented in different policy contexts, and that hopefully we can also glean more generalizable results in order to inform our future data policies surrounding crisis management. Thank you very much.